I am very worried and don't know much about diabetes. Can my family stay with me while I'm here?
Of course, it is important for them to be here so that you can all work through this together as a family. Once I explain, you will all better understand. I know that you may be very confused, but I'm going to do the best I can to explain type 2 diabetes and how to help you feel better. You have hyperglycemia, which is high blood sugar, and that is called diabetes. That is why you have been using the bathroom a lot, having blurry vision, and feeling weak lately. Your diabetes is manageable and something you can live with, but it is going to take some work and adjustments. Lewis, Dirksen, Heitkemper, Butcher, and Camera, 2011.
Okay, but I need a female doctor. I can't have a man touch me or look at my body.
I will make sure that you only work with females. Mrs. Asker, I just want to ask you a few questions written by Chu, Edwards, and Bocchio, 2004, before I start explaining all of this new information to you. How confident do you feel you are able to follow the instructions on the label of a medication bottle?
Quite a bit.
How often are medical forms written in a way that is easy to read and understand?
Sometimes.
How often do you have someone like a family member, friend, hospital clinic worker, or caregiver help you read hospital materials?
Often. Everything I do is filtered through my husband's and son's. I feel safe when they help me, especially because I do not have good English. If it is in Arabic, I can usually understand.
Now I'm going to explain to you what diabetes is and what caused you to develop it. The American Diabetes Association states diabetes mellitus is a metabolic disorder characterized by abnormally high levels of glucose in the blood. Glucose is a major source of energy for most cells of the body, including those in your brain. Carbohydrates, or carbs, that are found in fruit, cereal, bread, pasta, and rice. They are quickly turned into glucose in your body. This raises your blood glucose level. And insulin is a hormone produced in the pancreas. The pancreas is behind your stomach. Insulin is needed to move blood sugar, which is glucose, into your cells. There it is stored and later used for energy. So either your pancreas does not make enough insulin or the body is unable to use the insulin efficiently. When you have type 2 diabetes, your fat, liver, and muscle cells do not respond correctly to insulin. This is called insulin resistance. As a result, your blood sugar does not get into the cells to be stored for energy. When sugar cannot enter the cells, a high level of sugar builds up in your blood. This is called hyperglycemia or high blood sugar, which is what you have. Type 2 diabetes usually occurs slowly over time. That is why you may not have noticed the signs and symptoms until recently. Most people with the disease are overweight when they are diagnosed. Increased fat makes it harder for your body to use insulin the correct way. Family history and genes play a role in type 2 diabetes, as well as low activity level, poor diet, and excess body weight around the waist increase your chances of getting the disease, as well as being over the age of 35 years old. Studies have also shown that certain ethnic backgrounds are at a higher risk of developing type 2 diabetes. Some other risk factors include giving birth to a baby that was over 9 pounds, having a high blood pressure like 140 over 90, having your triglycerides, your fats above 250, and having a high cholesterol level. These make you more at risk for getting type 2 diabetes. I understand you participate in Ramadan, where you don't eat or drink all day before midnight for a month, which could affect your blood sugar levels, but we will talk about this later in our discussion. It is a good thing that you came in to get help because having a high blood sugar can lead to complications such as blindness, nerve damage, which is called neuropathy, and kidney damage. So today we did a couple of tests to determine if you had diabetes. A blood glucose test measures the amount of sugar called glucose in a sample of your blood. I am going to tell you about some of these tests we performed to diagnose diabetes with. Today we did a random blood glucose test. Your level was 215, and if it is higher than 200 and you have symptoms such as increased thirst, urination, and fatigue, which is tiredness, and you did experience that, we would confirm this with a fasting glucose test. But that takes a few days to complete, so we did not perform that. We measured your glycosylated hemoglobin, also known as a hemoglobin A1C test. That shows the average level of blood sugar, or glucose, over the past 3 months, which is 90 to 120 days. This test will show us how much glucose or sugar is attached to your red blood cells, which are your hemoglobin molecules. If you have too much sugar in your blood, it shows us that you have hyperglycemia. A hemoglobin A1C of 5.6% or less is normal. Yours was 7.3%, which is why we diagnosed you with diabetes. Considering you have been diagnosed with diabetes, an ideal goal to reach is 7%, according to the American Diabetes Association. But keeping your level below 6.5% will decrease your chances of having health problems and diabetes complications. Another test we could perform is an oral glucose tolerance test. For this test, you have to make sure you eat normally for several days before the test. You do not eat or drink anything for at least 8 hours before the test, and you cannot eat during the test. Ask your healthcare provider if any of the medicines you take can affect these test results. You will then be asked to drink a liquid containing a certain amount of glucose or sugar, usually 75 grams. Your blood will be taken again every 30 to 60 minutes after you drink the solution. Diabetes is diagnosed if the glucose level is higher than 200. 2 hours after drinking a special sugar drink. The test takes up to 3 hours. Lewis et al., 2011. Now there are some important things I would like to discuss with you.
Okay.
Mrs. Asker, do you have any problems with pricking your finger and getting a drop of blood?
No.
So when you are at home, I would like you to self-monitor your blood glucose levels. You will wash your hands with warm water, dry your fingers, and prick the side of your fingertip to get a large drop of blood. You want to check your blood sugar before meals and after meals. Your goal is to get between 80 and 140 before every meal, and you want it to be less than 160 after 2 hours of each meal, and between 100 and 160 before bedtime.
Why do I need to do this?
This monitor can let you know what your blood sugar is before and after meals. Testing at home lets you know when it is too high or too low. Testing your blood sugar at home will let you know how different types of food affect your blood sugar, how exercise affects your blood sugar, because exercise usually lowers your blood sugar levels, what your body sugar is and when you are sick. So severe illness or stress usually causes higher blood sugar levels. When your insulin dose may need adjusting. So if your blood sugar levels remain high over a period of time, or you have frequent low blood sugar, your insulin dose may need adjustment. You should write these in a diary and bring them back to the doctor when we have a follow-up so we can see how you are doing. I am also going to teach you about how to take care of your feet because having diabetes can affect your senses, especially the nerves on your feet. So you want to wash your feet every day. Make sure the water is warm, not hot. Pat your feet dry, especially in between the toes. You or a family member should check your feet daily for cuts, blisters, swelling, or redness. If you have a cut, use warm water and mild soap, then cover it with a clean, dry dressing. Then you want to call your doctor for an appointment because we will want to keep an eye on it in case it gets worse. Do not put lotion in between your toes, only on the outside is okay. If your feet get sweaty, you can use a foot powder. Do not walk around your house barefoot. You want to wear slippers. And make sure you wear clean cotton or wool socks and a good fitting shoe. You want to exercise your feet daily and try not to stand or sit in the same position for a long time. And try not to cross your legs. Lewis et al., 2011. There are different medications we can use to lower your blood sugar. One of the first medications we will try is called metformin or glucophage, which are the same things. This will lower your blood glucose sugar levels. You should still be eating a healthy diet and exercising. Metformin is under the category of biguanides, which treats diabetes and rapidly lowers your blood sugar levels. Its primary effect is decreasing liver production and release of glucose, but the drug is a mild insulin sensitizer as well. Metformin lowers the hemoglobin A1C levels that we talked about earlier. According to the U.S. National Library of Medicine, metformin causes only mild diarrhea, but when taken with food, you may not get diarrhea. Metformin can also cause reduced appetite and hypoglycemia. Metformin will not make you gain or lose weight. The liquid is usually taken with meals 1 or 2 times a day. The regular tablet is usually taken with meals 2 or 3 times a day, and the extended release tablet is usually taken once daily with the evening meal. You should not drink on this medication. You stated that you do not have kidney disease, liver disease, or heart failure. Is this correct?
Yes.
If you experience chest pain or have a rash, call your doctor immediately or get emergency treatment. The next type of drug we would use if metformin is no longer enough would be a sulfonylureas. Sulfonylureas, such as glyburide, will increase insulin secretion from your pancreas cells to reduce blood sugar as quickly as metformin did. 2 medications under this class are glipizide or glimepiride, and it is taken 1 to 2 times a day. Although effective, these extended regimens for this medication have greater rates of adverse effects. The most common adverse effects are increased weight, about up to 6 pounds, as well as hypoglycemia. So hypoglycemia is low blood sugar, and I mentioned it earlier. Some things you might experience with hypoglycemia is shakiness, hunger, sweating, anxiety, blurred vision. And if you lose consciousness because your blood sugar drops too low, you want to call your doctor immediately. And if these 2 medications do not work, you may need insulin injections if the blood sugar cannot be controlled. People with type 2 diabetes make some insulin, but their bodies don't respond well to it. Some people with type 2 diabetes need insulin shots to help their bodies use glucose from your food for energy. The main job of insulin is to keep the level of sugar in your bloodstream at a normal range, and yours is a bit higher, so this insulin will lower it. According to the Medical Surgical Nursing text, there are a couple different options for insulin you could choose. Rapid acting insulin works quickly but only lasts 4 hours. Then there is regular insulin, which lasts a little longer, so you may have to inject insulin a couple times a day. You may choose to take a long-acting insulin, which will work all day, so you'd only have to take it once. Some side effects to insulin could be allergic reactions. Taking too much insulin can cause your blood sugar to get really low, like I said earlier, hypoglycemia. Possibly during the night, you might have to check blood sugar between 2 to 4 a.m. If it is low, you need to cut back on insulin. If it is too high, you need to increase your insulin. You could also get lipodystrophy, which are lumps and dents in your skin from giving yourself the insulin shot in the same spot every day. So you may want to change the site where you put your insulin. You want to report to your doctor if you have a hard time getting your blood sugar in a normal range. So before you mentioned that you also like home remedies.
Yes.
The Mayo Clinic states some of the substances that have shown promise in helping to control blood sugar include alpha-lipoic acid, caffeine, cassia cinnamon, chromium, flaxseed, ginseng, glaucoma, and gargum, magnesia, oat bran, and soy. If you decide that you'd like to try an alternate therapy, don't stop taking the medications that your doctor has prescribed. And discuss the use of any of these therapies with your doctor to be sure that they won't cause adverse reactions or interact with your current therapy.